The topic for present video is QC release, discriminatory and biorelevant dissolution method. In this video, we are going to see what are the differences and similarities between the QC release dissolution testing, discriminatory dissolution testing and biorelevant dissolution testing and the dissolution method. I welcome all the viewers to the video, and after watching this video you will be able to understand in depth regarding the similarities and differences between these three dissolution methods, whether they are similar, whether they are different, and what is the relation between these three dissolution methods. If anyone asks you regarding the question on these three type of dissolution methods, then you will be able to give the exact answer for the question asked to you regarding these dissolutions. As we know, many of the time we get confused between the QC release method, discriminatory method and the biorelevant method. Generally, many of the professionals say that QC release is the QC testing method to release the batch. Discriminatory method is the method or the dissolution testing condition which can discriminate the good and bad batch. And when it is asked regarding the biorelevant dissolution method, that time many of the professional answer like the dissolution testing performed with the biorelevant medias. So these are the common type of answers, but after watching this video you will get complete understanding, and I request you to watch the complete video. So let's start with the video. Now see, dissolution is a very important test as the other test, and it is a performance testing. Dissolution test is a product specific test, and the dissolution testing is directly related to the bioavailability, and dissolution testing is also related with the safety and efficacy of the formulation. See, before absorption of the drug is required to be released from the formulation, or the drug is required to be available in the dissolved form or soluble form at the site of absorption in the GIT whenever you are considering the oral formulations. So drug is required to get dissolved before absorption, and that's why dissolutions become very critical test. Dissolution testing is directly related to the safety and efficacy as it affects the absorption and bioavailability. The rate of dissolution is related to the Cmax, Tmax, and the extent of dissolution is linked with the area under the curve or the dose absorbed. So dissolution test is related to the in vivo performance prediction for the drug product. You might be aware about the IVIVC, that is in vitro and in vivo and in vitro correlation. So dissolution testing becomes very critical. Now, dissolution testing is not only performed in the R&D, or it is not only performed for the batch release. It is required to be performed in all the stages of the product life cycle. In R&D, in technology transfer, during exhibit batches, after exhibit batches, during stability, and whenever there is commercial product, to release that commercial batch into the market, and also after the post approval changes. So all these justifications are given on the basis of dissolution. Dissolution is also a very critical test for biowaivers. So in-depth understanding about the dissolution is very important. Dissolution test is must for product batch release into the market. Many of the times the QC release, discriminatory and biorelevant dissolution is not fully understood by the people. Many of the colleagues and friends ask me regarding the differences between these three type of dissolutions. They ask whether they are similar, whether they should be similar or they are not similar at all. So be with me in the video and you will be able to answer all these questions. First of all, we will see discriminatory dissolution testing. Discriminatory means the testing which can discriminate between the two batches or between the good and bad. So it means to detect the batch with acceptable and unacceptable release or the drug dissolution. It should detect the batch with good release or bad release, or it should detect the bad batch and the good batch. So what do you mean by bad batch and good batch? So good batch means which will be able to pass in the in vivo, and bad means which will not pass in vivo or in the bio studies. This is the simple meaning. It should detect the batch made with variations outside the studied and validation ranges of CMAs, CPPs and stability. So if particle size is critical for the product and it is affecting the dissolution, then if you take the particle size beyond the validated range, then this discriminatory test should detect that change. That is the CMA, critical material attribute. Then CPP. For example, tablet hardness is the CPP. So compression force will become the CPP for hardness. And if you make a batch with highest hardness, so that should be detected by the dissolution test. Similarly, for wet granulation product, granulation time, binder addition time, this becomes the critical process parameters. Then stability. If the batch is failing in the stability, that should be detected by this discriminatory type of dissolution testing. It should detect and it can detect the batches made with significant variations. So if the batch is mismanufactured, that batch should be detected by the discriminatory dissolution method. See, here the method should not be over discriminatory and it should not be under discriminatory. The over discriminatory method means which can detect very small changes, that means which are permissible, and under discriminatory means the dissolution method which passes all the batches, whether these are made with changes or not. So discriminatory means the dissolution testing method and also the specifications which can detect the mismanufactured batches. The reference batch for the discriminatory dissolution testing is the batch which is studied in clinical testing or bioequivalence testing, or you can say it as a finalized batch. Generally, the pivotal clinical batch for generic product is a reference batch for showing the discrimination. Sometimes pilot biostudy batch is also taken into consideration to show the discriminatory power of the dissolution testing. Then come to the biorelevant dissolution testing. Till now we have seen the discriminatory type of method. Now we will see the biorelevant method or biorelevant dissolution testing. As the name indicates, the dissolution test done under in vitro testing conditions which are physiologically relevant to the GI pH, fluid composition or motility etc. Also you can add here the dissolution media volume, or you can add basket RPM or pedal RPM. So these are the dissolution tests made with simulations of the GI tract. This testing provides the information regarding correlation between the in vitro and in vivo drug release and the formulation behavior in the in vitro and in vivo. So in this testing we mimic the in vivo conditions in the in vitro setting. This is now the biorelevant method can discriminate the batches with good IVIVC as it mimics the in vivo conditions. Now you relate the biorelevant dissolution method with the discriminatory method. So now try to understand that biorelevant dissolution testing is also a discriminatory testing, and discriminatory testing is also a sort of biorelevant testing as it can detect the batches which are going to be passed in vivo or which are going to be failed in vivo. So in discriminatory dissolution testing and in also biorelevant dissolution testing, we are going to do the IVIVC. Now coming to the QC release dissolution testing or QC release dissolution method. Now whether the QC release dissolution test is required to be discriminatory or it is required to be biorelevant or it is required to be both discriminatory and biorelevant or it is required to be just a release test. That means just test, and if it is passing then release the batch, otherwise hold the batch. So you think on this and then we will move to the next slide. So QC release dissolution test is required to be both discriminatory, also it is required to be biorelevant, or in another way you can say it is required to be clinically relevant, because by this testing you are going to release the formulation batch in the market and that marketed batch will be consumed by the patients. So now QC release dissolution testing becomes very important, and as per the current regulatory scenario, the QC release dissolution testing is required to be discriminatory in nature. So whenever you are going to give the QC release dissolution method, always keep in mind that it should be discriminatory. Now if it is discriminatory, it will be biorelevant. So now QC release dissolution testing is required to be biorelevant. See, QC release dissolution test is to detect the batch with acceptable and unacceptable release or the dissolution. It is done to release the commercial batch into the market. QC release method is thus required to be discriminatory in nature for the batches with acceptable and unacceptable release. QC release method and specifications are finalized based on the dissolution of pivotal or clinical testing batches, and thus it is related to the biorelevance type of test. As you know, many of the guidelines are there which say that you should fix the dissolution method for QC testing or QC release based on to your pivotal clinical batches. Also there is a EMA guideline which says that your QC dissolution specification should be set as per the pivotal clinical batch release. So I have made many videos on dissolution testing. You can go to the playlist and you can watch those videos so that you will get good information. Now, you should be clear regarding the QC release testing. QC release is required to detect the mismanufactured batch. So that mismanufactured batch is also detected by the biorelevant method and also by the discriminatory method. To detect the batch failure due to storage condition and the formulation age. That means it will detect the stability failure also. Also, it should have the clinical relevance because the QC release method is required to test the commercial batch and to release the batch in the market. And this is the simple understanding, and it is the simple way to understand that QC dissolution test is required to be discriminatory and also biorelevant. So I hope you might have cleared your doubts regarding the QC release dissolution testing, discriminatory dissolution testing, and biorelevant dissolution testing. See, generally the QC release testing is not done in the biorelevant medias. QC release testing is done as a single point, or you can say as a Q point release test for immediate release formulations. Generally, profiling is not done for QC test for IR formulations. Depending on the formulation nature, VCS class of API, and the formulation design, you can do the profile also in the QC release dissolution testing. In the current regulatory requirement, the QC release method is required to be discriminatory and its specifications should be done on the basis of clinical batch or pivotal B study batch, and thus it becomes biorelevant type of test. So I hope I have covered the required points to understand what is QC release dissolution method, discriminatory dissolution method, and the biorelevant dissolution method. Thank you for watching the video. Please do like, share and subscribe to this video and share these videos with your friends and colleagues. Thank you.